I will really have a lecture where we talk about the upper limb amputations in general. So, for the upper limb amputations, of course, is anything that any surgery that I'm doing to cut any part of the upper limb. And the upper limb is from the shoulder down to your fingers. Do you understand? So the different types of upper limb amputation comes in depending on the site where I'm cutting. Okay, be through the shoulder joint, shoulder disarticulation. It could be all the eh, plus some parts of the chest. That's what four-quarter amputation. It could be through the humerus. That's what transhumeral. It could be through the radius. That's transradial. So different types. Okay, I could come to the wrist. I could come to the fingers. So just refers to any surgical removal of any part of the arm, ranging from the fingers up to the shoulders. Okay. So levels of upper limb amputations. You can have the finger and the thumb where you are removing the digits. Okay. You can have what? Through the metacarpal bones. These bones right here that give rise to the fingers. Okay. You can have through the wrist. That's what I was trying to explain. Okay. So let's use here through the wrist. Okay. You can have below the elbow where it is what? Through the radius bone. Anything within this region is below the elbow. You can have at the elbow. You can have above the elbow. Anything once it is not reaching the shoulder joint is above the elbow. You can have what? Through the shoulder, okay, reaching the shoulder joint now. Then you can have four-quarter amputation where there is removal of the arm plus some part of the shoulder girdle. For me, I could say some part of the chest region. So there are different reasons why I might actually want to cut these parts in any patient. Okay. It could be that they have had severe trauma, accident and crushing injuries. It could be that there is tumors, so bone and soft tissue cancers. It could be due to severe infections like gangrene and necrotizing fasciitis. It could be due to vascular disease leading to non-viable tissues. It could be due to congenital deformities. Okay. So post-amputation consideration is what? Rehabilitation after the surgeries. You do physical therapies to strengthen the remaining muscles. Prosthetics, where you give artificial limbs that restore function and appearance. The psychological support, okay, coping with loss of limb is crucial, and occupational therapies, where probably you try to, rehabilitate the person to be able to do their daily activities again.